we seamlessly collect, integrate, and structure those into a single compute-ready format. So regardless of whether it came from multiple different institutions, otherwise you just have a lot of data. Actually makes the problem worse sometimes rather than better to have more information. So we're processing not only the image documents, up and filing the structured data, the unstructured notes, regardless of where it comes from, right? You could have it in an image format, you could have it scanned in on your end. You got to think about what you want and go and look for it. I think if this is how the sausage is made, this sausage making, right? Get rid of the duplicates, organize the data, error correct, organize, normalize it. You can't just take medical records and throw them on ChatGPT and have it tell you what the answer is. Well, decision making, that you're not just getting a hallucination from the AI itself. And then the last piece is we don't want to trust them. So we want to then essentially do continuous human QA and QC. So we're actually running the same process with humans and then testing and validating our data so that we can come up with performance metrics in the same way you would do for a medical device, so sensitivity, specificity, et cetera, because at the end of the day, you're going to be delivering this information. It could be used for clinical care. You want to make sure that it's correctly validated. And we actually just published our validation methods in a paper. It's up on medRxiv, looking for peer review, et cetera. We think this is a really critical juncture, critical point for the use of AI in medical records. So being able to deliver a comprehensive set of medical history information, medications, and background enables this telehealth, digital health, and enables normalized and consistent decision-making across that process. We are now working with a number of healthcare providers. There's the other side of it, which is actually getting the information you need out of the EMR, which is equally important. And it increases patient throughput and encounters and revenue cycle for the provider systems we're working with. So if we take all of that and we put it together, we can actually create what we think of as the golden record for this patient. So we've taken multiple medical records from multiple providers, combined them into it, and made a single normalized medical record that you can now access and look for and search across it. So instead of having to try to search through records or paper, I already know what I need for that encounter. And I just want to see, did I get that information? So again, this ability to always go back to the source, because if you're going to use this type of information or this type of technology to make clinical decisions that are going to affect care, you need to have that source data. So picture of the timeline of a patient that could be displayed and all of the supporting documentation. So has this patient taken Herceptin, this cancer drug? We want it to go away and read the medical record for us and say, yes, indeed, this patient has taken that medication. By the way, here are the documents that make me think that it's read it, right? I think the way that I think about this overall is that we have this incredible opportunity in healthcare interoperability where we're exchanging data, and enormous amounts of data right now. But the question for me isn't just how much data are we moving around, but how useful is that data? And reduce, frankly, what's a real pain, which is trying to get everybody's medical records in a piece of paper, read those medical records and type it back into another EMR system again, which just seems like insanity to me. We've collected data from over 290,000 locations across the US, representing 40 million plus medical records at this point. And if you have a specific workflow where you already know what you're needing, then we're pre-configuring that workflow through that checklist function. So you're just getting the things you need. And most things are 5 to 10, maybe 20 fields that actually need to be completed. So thank you all.